I'm gonna film the whole room. There's the mannequin. My husband is gonna be filming the main video on my phone. We have my supplies. We have a scan of the whole room. So I'm gonna go ahead and begin. Go ahead and knock on door, close door, provide privacy. Hello, my name is Ruby and I'm gonna be your nurse today. The doctor has ordered for me to go ahead and start an IV. But first, can I get your full name and date of birth? Yes, it's Betty Beddington of March 3rd, 1967. Okay. Do you have any allergies today, Betty? No? Okay, I'm gonna go ahead and lift your bed up to working height level. I'm gonna perform a couple of procedures today. One of them is, like I said, to begin an IV. From the IV, I'm gonna collect a blood sample and then I'm gonna put it into a saline lock, meaning that it's gonna be ready for when the doctor orders some fluids or any medications to be infused. I'm also gonna be performing a dressing change on your central line and I'm gonna be collecting a blood sample from it. So I'm gonna place the patient in a low Fowler's position. I'm gonna go ahead and assess the vein, the area, according to the patient's condition for peripheral access. I'm gonna go ahead and gather my supplies. So for the purpose of this video, I'm gonna be using this arm, but I'm gonna go ahead and perform hand hygiene. I'm gonna go ahead and put gloves on. I'm gonna go ahead and place a waterproof pad under your arm, Betty. So for this, I'm gonna go ahead and place my supplies here on the table. If I can find where to open this. Okay. So I'm gonna gather everything here. I'm gonna gather the correct catheter size and prepare my extension tubing before I begin. Since I'm gonna collect the blood draw directly from my IV, I'm gonna go ahead and prepare that. I'm gonna have a sanitation wipe. I'm gonna have an IV saline so I can flush it. This is trash. Okay, so then I'm gonna go ahead and begin. You're just gonna feel me poke at the vein and I will let you know, okay? I'm gonna have you relax your arm, Betty. I'm gonna prepare. So first, I'm gonna palpate for a good vein. I'm gonna go ahead and disinfect the area for 15 seconds up and down in a back and forth motion. I'm gonna let that dry. I'm gonna place the tourniquet on the patient. Doing it in a quick release time. So then, once it's sanitized, I'm not gonna touch the area. I'm gonna go ahead and insert the needle at a 10 to 30 degree angle with the bevel side up. I'm gonna hold the skin taunt about 1 to 2 inches below the insertion site. And I'm gonna go ahead and insert. You're gonna feel a poke, Betty, okay? I'm gonna go ahead and insert it until I see blood return. Are you doing okay, Betty? Okay, we couldn't get it on that try, so I'm gonna go ahead and begin all over again. I'm gonna palpate, disinfect it once again. Disinfect the area. I'm gonna let it dry. And like I said, I'm gonna insert the needle at about 10 to 30-degree angle with the bevel tip up. Once it's dry, I'm gonna go ahead and insert it. Till I see blood return. Okay, are you doing okay, Betty? I'm gonna pinch the vein, quickly releasing the needle, placing it in the sharps. I'm gonna place the catheter in to grab my blood sample. I'm gonna go ahead and coming slowly. Coming slowly, but it's coming to get blood sample. I'm gonna go ahead and use a different one. I'm gonna collect the correct amount, the per facility policy. Okay, so once it's full, I'm gonna go ahead and disconnect it, place it to the side. I'm gonna go ahead and hold this in place, stabilizing the catheter. I'm gonna go ahead and place this. Doing okay, Betty? So put it in place. Making sure that it's stable. I'm gonna go ahead and remove it. The blood sample, I'm gonna go ahead and untwist this. I'm gonna put it into a saline lock. So after this, I will need to disinfect it once again. I would disinfect it for about 15 seconds. Since there was a blood draw from it, I'm gonna go ahead and about 5 to 10 mils. Release it. I'm gonna go ahead and tape this, throw this away. Put it so it doesn't disturb the patient. Okay, perfect. Get stuck on my fingers. I'm gonna make sure that it's stable. I would have clamped the tubing. Make sure everything is in place. And then I would have released the tourniquet. I'm gonna go ahead and dispose of my supplies. I would put my initials, date, and time that it was performed, just so they know. I'm gonna go ahead and dispose of my supplies. Okay, Betty, are you doing okay? Okay. So then this blood sample, I would give it to lab. I would have put my initials, date, and time, and then pass it off to lab, and they would take care of the rest for me. So after this, I would dispose of my gloves, perform hand hygiene, and I'm gonna go ahead and move on to my dressing change. Okay, Betty? I'm gonna take this out from under you. I'm gonna put all my trash, throw it away. Okay, I'm gonna go ahead and move this. Place this on my patient's chest just for the video. So I'm gonna bring them up to I'm gonna be performing your dressing change, okay, Betty, if that's okay with you. So I would have verified the prescription the doctor has ordered for me to perform your dressing change, just because it's been a couple of days since the last nurse has done it. So I'm gonna go ahead and bring this to my bed. I'm gonna place all my supplies for this over here. I'm gonna go ahead and place everything I need to my reach. So for this, before I begin, I'm gonna put on a mask and have anyone in the room put on a mask, just so you're not breathing on it, and so we don't get any sorts of infection going on in the area. I'm gonna have you wear a mask as well, Betty, okay? And so I put the mask on the patient. I'm gonna perform hand hygiene. I'm gonna go ahead and uncover your chest, Betty, okay? I'm gonna put on gloves. Put this right here. This is for the blood draw. So I'm gonna go ahead and remove the old dressing from it. steal away I can apply some adhesive remover. This is what it's for. I would apply it just so it's not as rough to remove it. Are you doing okay, Betty? I know this is really stuck in there, but I'm trying not to hurt or pull on your skin. So once I reach the catheter, I'm gonna be careful not to pull or tug on it. And so now that I got it unstuck, I'm gonna go ahead and pull up just to prevent from the catheter to be pulled out and be dislodged from the area. So I'm gonna dispose of this. Once I uncover it, I'm gonna notice irritation, redness, any drainage. I'm gonna go ahead and measure it. Being careful not to touch it. So it looks like it's about 22 centimeters. It looks like it hasn't moved. So I'm gonna go ahead and place this to the side. I'm gonna go ahead and remove my gloves, dispose of them, perform hand hygiene. This is when I would open my sterile packaging. So these gloves, I'm not gonna use them. So I'm gonna be careful to maintain sterile field. I'm gonna bring it closer, making sure and maintain, touching the very border of it. Okay, so now be careful. To maintain. Sterile field. But since my gloves ripped, I'm gonna go ahead and get some new ones. Throw these away. I have some new sterile gloves. Just because those ripped when I was applying them. So I'm gonna go ahead and begin once again. Being careful. Go ahead and put them on like this because I can't touch them. I'm gonna go ahead and place my finger at the top, still placing my hand underneath the cuff. I'm gonna go ahead and fix them. Placing my hand underneath the cuff, bring them back up. So now that I have my sterile field, I'm gonna go ahead and throw this away. I'm gonna go ahead and dispose of this. I'm gonna go ahead and open the antiseptic, and I would go ahead and clean it. One side up and down in a back and forth motion, throw it away. I would grab a new one, clean it up to back, up to down, throw it away. Then, using the last Q-tip, I'm gonna go ahead and use this to being careful so I can clean it under. Really slowly releasing it, throwing them away. Now that that's done, I'm gonna go ahead and I would place either some protective skin cream on if we wanted to. We didn't have to. I'm gonna go ahead and place an antimicrobial pad. I would also place a stabilization device on it. Once that is done, I'm gonna go ahead and grab my transparent. This is when I would place it over, being careful not to touch, maintaining sterile feel. I'm gonna go ahead and stick it to the area. Make sure it sticks. You doing okay, Betty? We're almost finished here. Once that is done, I will go ahead and label with my initials, date, and time. And since I already placed the dressing on it, I no longer have to be sterile for it. I'm gonna go ahead and place it in the correct area. After that, I'm gonna go ahead and dispose of my gloves and of my perform hand hygiene. I'm gonna go ahead and get rid of all of my trash. That's my trash. I'm gonna go ahead and get a sample that the doctor has ordered. So I'm gonna get clean gloves. For this one, I just want to be sure that I turn off any infusions that may be running. I want to use the most distal port if there's more than one lumen, but there's only one, so I'm gonna just use that one. I'm gonna go ahead and perform hand hygiene. Let my hands dry. I'm gonna go ahead and put on clean gloves. So this one shouldn't hurt. I'm just gonna go ahead and grab a blood sample from the port here. So for this one, I would remove the sterile caps from it. I would go ahead and disinfect it for at least 15 seconds. I'm gonna go ahead and grab a clean syringe. I'm gonna grab about 5 mils of blood that I'm gonna dispose. In the appropriate receptacle. It's going to the trash. I'm gonna go ahead and disinfect it once again, 15 seconds. I'm gonna grab a clean syringe. This is where I'm gonna collect about 5 to 10 mils of blood, whatever the doctor has ordered. I'm gonna go ahead and place it in the correct collecting tube. I'm gonna go ahead and once again, I'm gonna make sure there's no bubbles when I'm gonna go ahead and disinfect it once more for 15 seconds. I'm gonna go ahead and flush it with normal saline, about 5 to 10 mils, just to push all that back. Now this is optional. We can replace the injection caps, or we can go ahead and once we've replaced them, we may also flush the catheter with heparin according to facility policy. With that, we don't need to. I'm gonna go ahead, since we don't have any infusions running, I'm gonna go ahead and place a sterile green cap back on it for when infusions are used and to maintain sterility. I'm gonna go ahead and clamp this. Are you doing okay, Betty? Perfect, okay. I'm gonna go ahead and dispose of my gloves. Perform hand hygiene. And the blood would have been sent to lab because lab would have been with me in the room collecting it. It would have been labeled, date and time, my initials. I'm gonna go ahead and dispose of all of this. Collect it in the correct receptacle. Okay, so for next, I'm gonna go ahead and lower the patient's head. Are you doing okay, Betty? Okay, I'm gonna go ahead and lower you. Place your call light within reach. If you have any questions, please feel free to press it and I will come in. Then now that a couple of hours have passed, the doctor has ordered for her IV to be discontinued. I'm gonna go ahead and do that. I'm gonna collect my supplies. I'm gonna get clean gloves. I'm gonna get some sterile gauze. And so, okay, Betty, so your doctor has ordered for me to go ahead and discontinue your IV. It looks like you won't be needing any more medications or any fluids to be administered. So I'm gonna go ahead and raise your bed once again to height level. I'm gonna put you in a comfortable position, okay? So then I'm gonna bring my supplies. I'm gonna collect clean gloves, perform hand hygiene. The hardest part is for me just to remove the tape, but nothing too bad. So we're gonna just have some clean gloves. I'm gonna go ahead and have the gauze here ready. Okay, Betty, I'm gonna go ahead and begin. I would have made sure that the IV is clamped, I mean. I would have discontinued any infusions if they were going on, but we have nothing. I'm gonna go ahead and throw this away. Okay, so I'm gonna begin removing. Stabilization device. I would have noted if there was any complications such as infiltration, redness, any bumps, but there wasn't any. So I'm gonna go ahead and slowly remove this. I'm gonna go ahead and stabilize the catheter. I'm gonna go ahead and place a sterile gauze. Place it and slowly and steady parallel to the skin, as close to the skin. I'm gonna go ahead and remove it, making sure the tip is intact. I'm gonna dispose of this in the correct area, in the sharps. I'm gonna apply pressure for at least 30 seconds. Are you doing okay, Betty? I'm almost finished here. And I would apply a Band-Aid. Have the patient continue to monitor for bleeding if they have stopped. And looks like it's all good to go. I'm gonna go ahead and remove my gloves, throw them in my trash, perform hand hygiene. Okay, so it looks like we're all done, Betty. I'm gonna go ahead and lower your bed. Place your call light within reach. I'm gonna document what I performed today, discontinued your IV. And do you have any questions for me? Are you doing okay? Okay. All right then. Go ahead and lower you to a comfortable position. I'm gonna go ahead and make sure I have thrown away all my trash. I'm gonna dispose of this masks. And then I'm gonna go ahead and finish it. Done.